Okay. Good morning, everybody. Thank you so much for taking time out of your busy schedule to join me in order to learn a little bit about CBD dosing. If you don't know me, my name is Tracy Lee Young, and I've been immersed in the cannabis industry since the father of my 8 children was diagnosed with stage 4 throat cancer and given just 2 months to live in January of 2014. My research on options outside of radiation and chemo led me to cannabis, which was thankfully the option that we chose. Because he was able to live with cancer for more than 4.5 years. Now, I say live with because, as all of you may know, someone who has been diagnosed and given an extremely short period of time, those people literally digress and die right before your eyes. Cannabis actually helped him to live, meaning riding his bike, skiing, surfing, skateboarding, mending fences, and truly getting to know his children. He was living with cancer. Although we lost him last Thanksgiving, the experience gave me the drive to help others, and I opened our first cannabis clinic in April of 2015, and I've opened many since then. Now, owning medical cannabis clinics has allowed me to help well over 33,000 patients actually get back into the life that they're living, and cannabis has been a major reason. So I am also a medical cannabis consultant and a master director at Green Compass Global. Now, it's important to begin this training by letting you know that I am not a doctor, and this presentation is in no way offering any sort of medical advice. The information in this video will be very important, so I encourage you to take notes so that you can refer back to them in order to share what you've learned as people begin to ask you some of these questions. Now, an interesting fact is that cannabis has been growing naturally for quite some time. As a matter of fact, land-raised cannabis was found in regions from Apollo to Afghanistan thousands and thousands of years ago. Land-raised means it was not cultivated. And history tells us that cannabis dates all the way back to Greek historians who used cannabis for steam baths for wellness. And it was also noted in ancient India for a variety of ailments, including pain control in childbirth. So to date, cannabis can be found in every continent except Antarctica. So let's talk a little bit about the human body and learn the magnitude of what CBD can do for us. There are 11 major organ systems in the human body, and some you may be more familiar with than others, but they include the immune system, the digestive, lymphatic, circulatory, muscular, skeletal, endocrine, nervous, renal, urinary, excretory, and respiratory. Now, each one of those is very important, and if there's a dysfunction in any one of them, the result could be one or more conditions that would affect daily life in a very negative way. Cannabidiol, or CBD, is a type of cannabinoid, a natural chemical compound that's found in the cannabis plant that interacts with the endocannabinoid biological system in humans as well as other mammals. Now, the CBD products that we're talking about today come from hemp, a type of cannabis plant with relatively low concentrations of THC and higher concentrations of CBD. And as a result, most CBD products contain little to no THC. And thanks to the 2018 Farm Bill, which passed in January of this year, hemp was decriminalized at the federal level. So currently it's legal to grow, sell, buy, and consume hemp-based CBD products in all 50 states. CBD isolates require higher doses to be as effective as full-spectrum CBD extracts, but that doesn't mean full-spectrum CBD is a better therapeutic option than CBD isolate. Although it has a wider therapeutic window than a CBD isolate, there are many reports from patients and experts that suggest a synergistic combination of CBD and THC and other cannabis components can be effective at very low doses, truly as little as 2.5 milligrams of full-spectrum CBD. Some patients may require significantly higher doses of CBD to obtain a satisfactory result. Now, keep in mind that CBD and THC and cannabis in general have what's called biphasic properties, meaning that low and high doses can produce opposite effects. An excessive amount of CBD could be less effective therapeutically than a moderate dose. So I speak to people every single day who ask for dosing advice. And I know that when they call, well, and you being on this training, you're all hoping for a really simple answer to the questions like, how much CBD should I take? What dose is best for migraines? What about sleep? Unfortunately, this does not come with a simple answer. Because of CBD's diverse nature, the CBD isolates react differently in the body from a full spectrum product. And the fact that everyone reacts differently to cannabinoids in a unique way, dosing is really all over the place. So for example, doses will differ by product. So for example, we've got 500 milligrams, 750 milligram, 1,000 milligram, and a 2,500 milligram. It's exciting that studies are consistently showing that CBD may offer much needed relief for the debilitating symptoms of many conditions, including cancer, Alzheimer's, PTSD, Crohn's disease, Parkinson's, and many, many, many others. CBD is a natural compound found in the hemp plant with none of the adverse side effects of prescription medications and without that high effect from THC and marijuana. And while traditional medications may become less effective over time or stop working completely, CBD users are hailing the long-lasting benefits, with many giving up their pharmaceuticals for good, which is very exciting. Studies are ongoing, but the returns indicate that CBD is an exciting alternative to traditional medications. And I see this oftentimes in the clinics that I own. We've got patients that come in and literally have Excel spreadsheets that are listing just pages and pages of medications that they take daily. That, in my opinion, is no way to live life, as you really are setting an alarm for the next time for your medication or whatever the next dose is. That to me is just crazy. So to start, let me tell you a little bit about and help you understand the biphasic nature of CBD. To be biphasic is to have differing effects in the body at different concentrations. Practically speaking, this means it will have one effect at one dose and the opposite effect at others. Alcohol can be a perfect example of a biphasic substance that anyone, well, most of us who have had a few too many drinks, it would be familiar with this. It's a stimulant, right? You have a couple of drinks, you're feeling good, and you feel really good up until a certain point, and then it quickly becomes a depressant. CBD is biphasic as well. And this would explain why dosing can be very confusing. And it's also why you'll hear conflicting information about the health benefits. Insomnia is another perfect example. You might hear that CBD is great for sleeping. And then maybe in another conversation, somebody will praise CBD for the energizing effect or its ability to increase alertness. Well, the truth is that CBD has been shown to do both of those things at different doses. And what that means is doubling your dose of CBD will not make it twice as strong. In fact, it might actually make it less effective. So now you're thinking, oh my gosh, that's all great information, but now you may be more confused about where to start than when we began, right? Well, the Green Compass tincture product line comes in a variety of strengths and flavors. We've got a 250 milligram pet tincture, and for humans, we offer 500 milligrams, 750 milligrams, 1,000 milligrams, and a 2,500 milligram. You can choose mint, citrus, or natural flavors. And let's move on to learning about how many milligrams are in CBD products. The concentration or strength is going to refer to the total amount of CBD that's given in a product. The concentration is measured in milligrams. Now, this is different from dosage, which indicates the amount of CBD that's in each serving. So, for example, let's say that a bottle of CBD tincture has a concentration of 750 milligrams, and it contains 30 milliliters. A 1 milliliter, which is the standard serving size, or also the amount of one dropper full, means that 1 ml serving will contain approximately 25 milligrams of CBD. Now, You're not ingesting 750 milligrams with each dosage. And you may be wondering, okay, what does all that mean? How in the world did I come up with all those numbers? Well, it really is easy math. It certainly isn't brain science. Let me break it down for you. You're going to take the amount of milligrams in the bottle. You're going to divide that by 30 because that's what each bottle holds, 30 milliliters, and each milliliter is 1 dropper full and 1 dose, right? So for example, a 500 milligram bottle divided by 30 equals 16.66 in each ml or dropper full. So again, if you have a bottle of 500 milligram tincture, the flavor's not important, they're all the same. Each dropper, which is 1 ml, is going to contain about 16 milligrams of CBD. So if you have a bottle of 750 milligram tincture, each dropper will contain about 25 milligrams of CBD. If you have a 1,000 milligram bottle, each dropper full will contain approximately 33 milligrams of CBD. And each full dropper of the 2,500 milligram tincture is going to contain about 83 milligrams of CBD. The PET tincture contains 8 milligrams in a dropper, but a full dropper may not be the proper dose, for a little tiny dog. This is all really important if you understand that many experts will recommend that you start with as little as 3 or 5 milligrams and then titrating up from there. An important thing to remember also is that the doses for CBD don't have anything to do with how much you weigh or whether you're a man or a woman, like so many other drugs. If you go to a doctor, those are the first things they look at, right? How tall are you? How much do you weigh? Are you a man or a woman? There are a lot of areas that they look at in order to dose you with a prescription med. So instead, CBD has everything to do with how your receptors are clustered in your body and the current status of your ECS tone, which is why there are no official recommendations when it comes to CBD dosage and why so many people are confused as to why it isn't simpler. So now you're wondering, okay, so what does this look like in real life? Well, one person's headache might respond to 6 milligrams of CBD, while another person with the same type of headache might need 50 milligrams of CBD. The dosing conversation can get really overwhelming. It's really not simple to break down, but don't worry. There have been no reports of somebody having a violent reaction from taking the wrong doses of CBD. Its effects are very, very subtle. The key is to start very low and to go slow and to remember that less is more and always stay in tune with your body. Now, studies show that people that are taking between 10 and 100 milligrams on average daily, most are taking about 15 milligrams twice daily, which equals about 30 milligrams, and that seems to be the average dose across the board. So here are some dosing suggestions. Starting with about 8 milligrams. That's about a 0.5 ml if you're using a 500 milligram tincture twice daily for a few days. Now, if you don't feel any change, try moving up to 16 milligrams, which is about 1 ml or a full dropper twice daily. You're going to continue titrating up and waiting a few days each time you titrate up to determine if you're getting a result before increasing the dose. You're going to continue all the way up to about 45 milligrams twice a day. Stay here consistently for a few weeks, even possibly up to a few months. There really are some experts that say it can take that much time to reach the full potential. Now, if you're thinking about going higher, this would be a really good place to pause and consult a professional. I'm happy to speak with you, speak with your doctor. If you know somebody else that's very well schooled in CBD, they may be a good person to consult with. Over 100 milligrams daily is considered a high dose of CBD, and there may be some things outside of that to consider or to change that might help increase your absorption. I always say adding a high-quality omega-3 oil is an excellent supplement to add to your daily regime. This might have you a little bit curious as to why it's better to take an omega-3 fatty acid. Well, the reason has to do with human biology and how that has to do with human biology, right? The fats interact with the endocannabinoid system. Now, without enough omega-3s in your diet, the ECS is not going to be capable of providing the benefits that come with CBD supplementation. Omega-3 fatty acids are critical to the health and function of our ECS. So if we're not taking omega-3s and our diet is deficient, it's obviously going to take us a lot more product and a lot longer to see any results. Omega-3 fatty acids are involved in our endocannabinoid synthesis, and studies have shown that omega-3 fatty acids are a precursor to the cannabinoid produced within our bodies. Also, the ECS receptor function, as omega-3 fatty acids are involved in the growth and repair of ECS receptors. All this is really confusing, and I apologize. I'm going to try and keep it simple. When you don't get sufficient omega-3s from your diet, your ECS will suffer. Not only will it help to create as many endocannabinoids, but the receptors will also dysfunction. So it's important to keep you paying attention to how your body's feeling and how your body's reacting as you continue on this journey with CBD. I always say it's a great idea to keep a journal or to log and keep track of your progress, or at a minimum, jot down your symptoms or your lack of change in symptoms, even on a calendar, just so that you can monitor your progress. Now, how you take your CBD is very important, and your results are going to vary with the method that you choose. A tincture has the very best effect when it's placed under the tongue without food or drink, and it's allowed to sit there for 60 to even 120 seconds in order to allow your body to absorb it into your bloodstream. Now, there's no harm in adding it to a drink or to your food, but remember, this means that it must go through your digestive tract, and it will lose some potency and efficacy. The way that I do it, which is very simple, so if you can get into a routine, is the first thing I do in the morning when I wake up is I take my tincture and I drop it under my tongue. I don't swallow it, I don't swish it, I don't add any water, coffee, or anything. And I get up, I go about my morning routine, whether it's starting the shower, plugging in the curling iron, starting the coffee pot. And all the while I'm doing this, my tincture is just sitting under my tongue. By the time I get ready to actually step into the shower or put that mug of coffee up to my mouth, the tincture has already been absorbed and my body's put it to use. So now let me answer some common questions. Like I said earlier, I get calls every single day or speak with patients in the clinics every single day. These are the most common questions. How long does it take to feel the effects of CBD oil? Well, for some people, the results are going to be immediate. A lot of people will notice better sleep the first night they take CBD. And for others, it might take 2 weeks to a month to even notice anything. So it's important to be patient when you're starting to take CBD. It's going to be much different than taking Western medicine, like an Advil, where you're going to get some relief in 20 minutes, right? Now, I've been taking CBD oil for a while now, and if you're not feeling anything, I completely understand, and it can be frustrating. If you've been taking CBD for an extended period of time and you're not getting the results that you're looking for, chances are you are not taking a high enough dose. So it would be safe to say it's time to titrate up. Now, the general recommendation for dosing is to start low, about 16 milligrams per day, and go slow, gradually working up. And I would stay on that dose for 5 to 7 days. And if you don't see a result, titrate up. And again, stay on that new dose for, 5 to 7 days. Always logging, whether it's in your journal or on your calendar, what your progress is, if any. Now, for somebody that isn't struggling with major inflammation or mental health issues, a 10 milligram daily serving at night should be enough for most people to sleep better, but occasionally more might be needed. For more extreme issues such as depression, anxiety, or chronic pain, you may need as high a dose as 60 milligrams a day. It's important to experiment to find the right dose that you need, which is important. And it also reiterates the fact that you've got to give it time, You've got to be patient, and you've got to note your progress. Hopefully you're seeing how difficult this is to dose, and it can be a question that's very difficult to answer. How quickly is CBD going to work for me? Or how am I going to respond to CBD? Each person is going to respond differently based on the health and the density of their ECS receptors. So I'm going to recap just for a second. There are people who have a higher density of receptors, which will make them very receptive and sensitive to the introduction of cannabinoids, meaning they may feel a result almost immediately with a very low dose. Now, likewise, there are many people with a lower density of receptors. We call those people cannabinoid deficient, and it will take them a little bit longer to respond to the introduction of CBD. We would also encourage those people to add a very high-quality omega-3 oil to their diet daily. Now, many people are also asking about the benefits of a tincture. There are a list of reasons why I choose a tincture. It's safe. It has long-lasting benefits. It can be standardized. There are no carcinogens. They're easy to use. They're stigma-free, and they're very discreet, which makes them very easy to use almost anywhere you go, right? The ease and use of the fact that a tincture is very discreet can be important for a lot of people who are trying to avoid that stigma that often follows cannabis. It's also very convenient. You can take your drops out, put them under your tongue, and go about your day as usual, then add more drops in the evening. It's also very simple to administer, so pediatric as well as geriatric patients are great candidates for a tincture. Each batch should be consistent, which is a huge part of the picture when it's being used for medicinal purposes, as many people rely on the same meds in order to get the same results every time to avoid the roller coaster of imbalance. Now, this is a really good place for pause when we're considering the quality of the products that we're taking. I've partnered with Green Compass Global, and the reason I've partnered with them is because they have the highest quality, the highest level of integrity, vertically integrated organic products, so you can be sure that every batch is going to be as consistent as possible. If you have not seen the film clip of Dr. Oz and Fox 11 going into different dispensaries, buying a variety of different products that are actually tested at a third-party lab, you should watch that, and that will show you the importance of educating yourself about other products that are on the market and why you want to steer clear of them. The other reason I enjoy a tincture is that there's no device required, which helps people on a very limited income. There's no inhalation required, which is ideal for those with compromised lung function, and there's no risk for inhalation of carcinogens, which we're reading a lot about in the news today. Oils have a slightly longer onset of relief, but the effects can last 6 to 8 hours or more, which is a very viable option for longer term relief or for symptoms that will last all day or overnight. So here's going to be a few tips for making sure you get the most out of your CBD experience. I need you to listen to your body, and if you just feel off or that something's just not right, consider cutting back on your dosage. Or if you're not getting the results that you're looking for, increase your dose, but pay close attention to your body. And again, I encourage you to consider keeping a journal to track your results. Be consistent with your dosing. It's really important that you take your dose daily for maximum results. Missing a dose will lessen the amount of CBD in your system, and that means that you'll be decreasing its efficacy. Now, some people may benefit from spreading out their dosing schedule, and what that means is sometimes it might work best to take a 10 milligram dose 4 times a day throughout the day, which gives you a total of 40 milligrams, but it's just spread out, rather than just one large dose in the morning or one large dose in the evening. It's also another reason why experimentation is important and listening to your body. Microdosing is a great example. I have many people that will buy a higher milligram bottle and do 1 drop several times a day, and it gives them great results. Now, it's very important to remember that what dose works for one person might not work for the next. The period of time it took for the CBD to take effect might vary as well, all right? Just as people react differently to medications, we're all going to react differently to CBD. So be patient and experiment while listening to your body, and you're likely to get the benefits that you're looking for. I've spoken with many CBD experts, and they all agree that the safety profile of CBD is pretty miraculous. Every single one of us, as well as the patients and the expert, state that normal doses, meaning anything under 100 milligrams a day, will have really no big safety concerns like overdosing and CBD drug interactions. To date, and according to research anyway, taking higher doses of CBD has been associated with symptoms like headaches and fatigue, but nothing more serious than that. So with that being said, it's definitely worth mentioning that at certain levels, CBD is shown to temporarily deactivate the cytochrome P450, which is an important group of enzymes that work to metabolize a wide range of drugs and compounds that enter the body. Now, you may or may not have heard the rule that you shouldn't eat grapefruit with certain medications, and that's because grapefruit also blocks that cytochrome P450. Now, unfortunately, there's no exact cutoff dose for CBD and its interaction with P450. So the best game plan is that if you're taking CBD long-term or at really high doses and you're taking any other medication, talk to your doctor or an expert who can advise you on the medication's interaction or potential interaction with CBD. So I'm going to review briefly. When you're using CBD oil, the goal is to find what I call your sweet spot. For pain, a good starting point might be somewhere between 15 and 20 milligrams, taken 1 to 2 times a day, or perhaps up to 3 times a day when the pain is extremely severe. Now, when it comes to treating depression, anxiety, or other psychological disorders, smaller doses are recommended, typically less than 8 milligrams each. And with that said, a lot of people have taken several doses of CBD oil in excess of the 40 milligram dose per day, and they didn't notice any adverse side effects. And as I mentioned earlier, it's merely a matter of listening to what your body needs and exercising due diligence. First, you have to determine how your body is going to react to CBD, and from there, you can implement a systematic dosing pattern. By doing so, you're going to enable yourself to determine what the best CBD oil dosage is that will work for you personally. It can be relatively easy to experience medical benefits from cannabis. Now, in recent years, the advent of cannabis oil products have transformed the therapeutic landscape and changed the national conversation about cannabis, right? We're seeing it everywhere, from Walmart, CVS to DSW shoes. It's really no longer a question as to whether CBD has medical value. Now it's just about figuring out how to optimize your therapeutic use of CBD to suit your lifestyle and your situation, as well as being sure that you're using the highest quality product available. You want an organically grown, vertically integrated, flower-only, CO2-extracted product that has third-party lab-tested COAs for each batch. Pretty much everybody has their own personal CBD oil dosage protocol. So, just like your thumbprint, you've got a CBD print, and we just need to be patient and find what works for us. I really appreciate you joining me today and learning a little bit about CBD dosing and how challenging it can be. I hope the information that I've provided has been helpful to you and that you will be able to move forward and find exactly what works for you. Have a wonderful weekend. Thank you for joining.